Joined now by the Democratic Alliance's Jack Bloom. He is, of course, a member of the Gauteng Provincial Legislature. Mr. Bloom, thank you very much for your time. You know, it was actually quite heartbreaking listening to Dr. Mandisa Kubeka, the tone of her voice, as well as what she said. I don't want to be here anymore. I don't want to work under these conditions anymore. When is anyone going to hear me, hear us? Do you think she speaks for the broad majority of medical personnel in South Africa at the moment?
Well, absolutely. You know, our casualty departments are like war zones and, you know, doctors are under threat. They're trying to save lives, but there isn't adequate security. This situation's gone on for far too long. I know the situation at Lillian Ngoyi clinic. It really, the doctors have been under threat there for some time. They've called for extra security and precautions. Nothing's happened, and it's time their voice was heard.
Why do you think nothing happens? Do you think it's purely because there isn't enough money to help doctors and nursing staff and protect them properly? Is it just that we are an overstretched health sector?
Well, look, I think there's very poor management. There's a lack of empathy with what doctors have to go through. But I don't buy this that we don't have enough money. There's just so much wastage and mismanagement and, frankly, corruption. You know, the Gauteng Health Department spent R500 million, 5 million rand, on a white elephant hospital in the far West Rand, which has hardly seen any patients and just going to drain us of more money. So, I mean, frankly, they have a very large budget. They should use it properly, and they should secure security for patients and staff, which should be able to be done. We know how to do it. Why not do it?
You are referring, of course, to the Anglo Ashanti hospital on the West Rand, and we know that that was seen as a bit of a lifeline when we were in the midst of the worst of the third wave. Are you saying it just simply wasn't used, despite the desperate shortage of beds in our hospitals?
It's seen a handful of patients. It's still not actually completed, despite 500 rand that's been spent. And it was supposed to be ICU beds, and all they had was less than 40 patients, and they didn't have oxygen for them. It's the wrong area. What they should have done is taken the 500 million rand and spent it on other hospitals in the West Rand, and a hospital like Helen Joseph Hospital. You know, Helen Joseph Hospital has been absolutely flooded with patients because of the closure of the fire at the Charlotte Maxeke Johannesburg Hospital. Of course, there's all the COVID-19 cases. Their casualty department's been an absolute disaster for months now, and yet we've spent money in the wrong places. The Helen Joseph Hospital has 148 staff vacancies at the moment. They should actually have a far larger staff establishment that they have in the first place, because they're a tertiary hospital. But they've also had 4 times as many psychiatric patients as previously, and they can't cope. And they've had assaults on staff, and other patients get assaulted as well. And, you know, people die. That's the reality of the situation when a hospital is totally overstrained without proper resources, and meanwhile money is just wasted elsewhere.
Well, thank you very much for chatting to us, raising important issues, not only about Lillian Ngoyi, but also the incredible pressure that staff at Helen Joseph Hospital